Good morning, everyone. I'd like to very sincerely welcome you to UN Women's side event as part of the 8th Asia-Pacific Forum on Sustainable Development under the theme, Standing Up to the Challenge, Response to the COVID-19 Pandemic in Asia and the Pacific. My name's Sarah Knibbs, and I'm the UN Women Regional Deputy Director, and I'm really honoured to be moderating this event today. Today's webinar is hosted by the UN Women Regional Office for Asia and Pacific, with the aim of highlighting the need to adopt a more gender-responsive approach responding to the impacts of COVID-19. The discussions today will seek to illustrate how gender impacts of the COVID-19 pandemic have permeated the region, and we'll also try to showcase how different actors have scaled up their efforts to tackle those impacts. Over the next hour and a half, we'll outline some of the priority actions in addressing emerging regional challenges, implementation gaps, and strategic entry points in order to accelerate the achievement of the 4 selected Sustainable Development Goals under review as part of the APFSD. These are Goal 3 on good health and well-being, Goal 8 on decent work and economic growth, Goal 13 on climate action, and finally, Goal 16 on peace, justice, and strong institutions. The COVID-19 pandemic has unleashed an unprecedented crisis, taking a toll on all countries across Asia and Pacific region. It not only threatens to reverse decades of progress towards fully realizing the 17 SDGs, but it also exacerbates fragilities and inequalities within and among nations. Women and girls are unfortunately among those bearing the heaviest brunt of the pandemic's devastating effects. The crisis has contributed to reinforcing gender disparities and will impact ability to reach SDG goals. The COVID-19 pandemic has overwhelmed health systems worldwide, making it more difficult for people to seek the medical care that they need. And in most countries, women are more likely than men to have experienced physical illnesses since the pandemic was declared. In fact, in certain remote areas, women are encountering more barriers than men to see doctors. As health providers divert their resources and services to respond to the outbreak, women and girls' access to essential sexual and reproductive health and rights are disrupted. The COVID-19 pandemic has rapidly turned into a profound economic crisis, affecting people's livelihoods and participation in the labour market. Women's pay has fallen as formal workers see their hours reduced, and informal workers lose their jobs. This vulnerability is further exacerbated by the lack of social protection affecting many women. Apart from this, women and girls are disproportionately affected by climate-related impacts due to underlying gender inequalities and socioeconomic disadvantages. The COVID-19 pandemic has rendered them more vulnerable to climate change due to their inadequate access to essential resources and limited adaptive capacity. We also note that violence against women has increased across the region. As a result of strict lockdown measures, many women and girls are confined with their abusers, with limited options for help seeking in confidence. While these measures jeopardize women's safety, institutional responses continue to remain inadequate. Drawing from the assessment of progress on SDGs at the regional level issued by ESCAP in February 2021, there are a number of priority areas and opportunities for stakeholders to take concerted action in strengthening policy coherence in their implementation efforts. And since all of the SDGs are interlinked and mutually reinforcing, it is also apparent that the advancement of Goal 5 on gender equality and women's empowerment, in tandem with the other SDGs under review, will have a multiplier effect on building an inclusive path for sustainable and resilient recovery from the COVID-19 pandemic. The principles on which the SDGs were established are key to building back better in a more inclusive, equitable, sustainable, and resilient manner in the post-COVID-19 world. In order to achieve the ambitions by 2030, response and recovery efforts must centre on leaving no one behind, especially those who are already vulnerable and marginalised. So the COVID-19 crisis actually offers us a valuable opportunity to reassess the SDGs framework, which somewhat neglects the crucial gendered implications of realising the 17 goals and 169 targets. Taking all of these dimensions into account is as vital as ever. Due to the interconnectedness between the SDGs, it is crucial to address gender dimensions of COVID-19 impacts in a more holistic way. So I'm very grateful that we have with us today 4 distinguished panelists to help shed light on the 4 SDGs under review, as well as to help us identify priority actions and strategic entry points for the integration of gender into policies to accelerate the realization of the SDGs by 2030. I'm very honoured to introduce you to the panellists who are joining our discussion today. First, from Thailand, we have Dr. Tanarak Plipat, Inspector General of the Ministry of Public Health of Thailand. Secondly, from Malaysia, we have Nadira Yusoff, who is the founder and CEO of KiddoCare. Thirdly, we have Nguyen, Sustainable Energy Manager from Green Innovation and Development Center, GreenID, in Vietnam. And fourthly, from India, we have Ashok Pamidi, who is the CEO of the NASSCOM Foundation, creators of MyAmbar app. There is so much more work to do together. It is my utmost hope that you will be encouraged by today's discussions and enjoy hearing about how these actors took the pivotal opportunity to rise to the challenge of a generation by remaining resilient during difficult times to build back a more equitable future for everyone. I'm really honoured to welcome you all to this meeting. And now I would like to open the panel discussion. And I'd like to remind all of the guests joining us this morning that you're really encouraged to use the Q&A chat function to ask questions, and we will answer as many of those as we can during the Q&A after the panel. So for our first topic, we will turn to goal 3 on good health and well-being. Our panelist, Dr. Tanarak Plipat, the Inspector General of the Thai Ministry of Public Health, isn't able to join us live today, but my colleague Maria Holzberg had the opportunity to sit down for a brief discussion with him earlier last week. During the onset of COVID-19 in Thailand, Dr. Tanarak was the Deputy Director General of the Disease Control Department, oversaw the implementation of the Village Health Volunteer Initiative that has been a key part of primary healthcare in Thailand. We're very pleased to share their conversation. I would like to pass the floor to Maria and Dr. Tanarak.
Prevention, preparedness, and response have been so closely linked to the implementation of the Sustainable Development Goal 3 on good health and well-being. We would be very interested to hear your perspective on how has COVID-19 impacted women and girls in Thailand.
Let me share how we respond to COVID-19 and COVID-19 impact on health in Thai population by going back probably a few more years. Back in 1977, Thailand has started a very important program. It is primary healthcare programs, which gave birth to about 1 million village health volunteers today, and it also gave birth to migrant health volunteers as well. And back in 2000, about 2004, 2005, another program was established, that is National Health Security Programs, which we have, or everybody knew about it as a 30 baht health scheme. And then it became free for everybody. That is, access to healthcare in Thailand is free. Both programs was very important in response to COVID-19, especially for access to healthcare for women and girls. In Thailand, we don't have that much disparities of gaining access to healthcare between women and men. That is, Thai women and girls can get an access to healthcare very easily and equally when compared to men. During the COVID-19, there are several routine services that need to postpone due to COVID-19. For example, antenatal care, which the services has been interrupted because several hospitals has to change from just a normal hospital into being the COVID hospital taking care of COVID patients. Those kind of services that has been affected has been rescheduled or replanning or redesigned by having health centers or in Thailand we call health promotion hospital, taken care of antenatal care services instead of large hospital that taking care of COVID-19 patients. So there has been something that has affected the health services to women and girls, and we have to redesign the system so that the impact will not be that great and service could be continued. This kind of disruption or interruption of services we have never experienced this before, but everybody in the health services has done quite, I have to say, a very good job on trying to make this kind of services continue as best as we can. Another issue probably is that is related to the impact of health and welfare of women and girls is mental health services. During the COVID bring stress and certain level of mental health issue into almost every sector of population, the just general population, the affected population, high-risk population, as well as men and women who giving care for COVID patients. So by noticing that we are having the challenges, our mental health team has done quite a very good job on trying their best to screen, to evaluate the mental health level, and then identify the high-risk person. And then they also reach out to those persons as best as they can. They have done routinely checkup online. The services can be accessed by online, and village health volunteers also help identifying persons who may be at risk of having those kind of stress or mental health issue, and then refer them to the mental health service provider. In this way, we could identify anybody, not just women and girls, who may have been affected by COVID indirectly, and then we can reach out and giving care to them as good as we can. So along the way, there are several issues that has been evolved or has been identified, and then we have to redesign our system so that we can care for those persons who has been affected as good as we can. In Thailand, the disparities of having access to health services, physical, mental, or other kind of services is not that the gap is not that large when compared to other countries. So even during the COVID-19, we did not have a problem with women and girls gaining access to healthcare.
Thank you very much for that thorough response, and thank you for highlighting also the importance of bringing in the mental health and psychosocial support, where the approach that Thailand has used is really a good practice. Another good practice is what you touched on about the 1 million health volunteers, which can be utilized to create awareness and provide information on preventative measures, deliver medicine, and collect data for public health. So these are two very interesting good practices. My second question is, what, in your opinion, are the challenges in implementing this initiative?
Since primary healthcare programs has been established for quite some time, more than 40 years. Currently, we have, as I mentioned earlier, we have more than 1 million village health volunteers, and we have more and more migrant health volunteers. For the rural areas where we have a lot of village health volunteers, the programs went very, very well, especially outside Bangkok. Even in the industrial province such as Samut Sakhon, which we have more than 1 million population, but village health volunteers still work very, very well. But in the large cities such as Bangkok, we have a little bit of a problem. I would not say that it's a big problem. We have challenges due to the lifestyle of urban population, of people living in large cities. Not that we don't have that as much as village health volunteer in Bangkok when compared to other provinces. And due to lifestyle of Bangkokians, the effectiveness of village health volunteers may not be as good as the village health volunteer in rural areas. We are trying a lot of approaches, but no one has been that effective. But for BMA, for Bangkok Metropolitan Administration, they are still trying to find a way so that we can implement these primary healthcare programs and also having a good implementation of health volunteers in the large city.
Thank you very much for that response. And I would like to ask you the final question, which is, what advice would you give to others in initiating or starting something similar in their countries?
I believe that different countries having different context. The village health volunteer programs has been so successful in Thailand because of our culture, because of the ways of life that we have, because Thai people like to help each other, and the ways that we social in other provinces, not in the large cities. The programs can be a very good lesson for a lot of countries. But if you like to have this kind of the same kind of success, you may have to adjust the programs as the context in your countries could be given to you. This will depend on several things, I believe. If the programs are going to be successful in other countries or not. Some of the countries in the regions which doesn't have a lot of different in terms of cultures, in terms of lifestyle. It has been shown that village health volunteers can work in that country as well. So having health volunteers will help the health system in so many ways, especially in the countries where, health personnel, well-trained health personnel still have limitation reaching a lot of people. The ways that village health volunteer can help health system in different countries will depending on the setting of health system and depending on what responsibility and how well that country could train the health volunteers. In Thailand, as I mentioned, we have a long history of having health volunteers. They have worked with us for quite some time. So we have a very good training programs. We have the system that could link the health volunteers to health promotion hospital. There is meetings, informal and formal meeting between health volunteers and health promotion hospital every month. And every year we have a training session. If we need village health volunteers to help us on different other issues. So having a good relationship between health system and health volunteers, having the contact point and having training, very good trainings in improving that capacity, and having a very strong political support from high levels. In Thailand, we have a very strong support up to the Prime Minister level, down to Ministry of Health level. Everybody support our policy on having health volunteer as part of our health system. Those kind of things would help implementation of village health volunteers.
Thank you so much, Dr. Tanarak, for sharing your insights from the Thai experience. And I think it was particularly interesting to watch the video as well, and to really see highlighted the very important role that women played as village health volunteers and also in the primary healthcare system here in Thailand. So next, we will be moving on to talk a little bit about Goal 8 on decent work and economic growth. We all know that COVID-19 initially began as a health crisis, but it soon became much more. And one of the areas that it has particularly affected for all of us is economic life and the state of the economy in general. And this economic crisis has particularly impacted women's livelihoods and women's participation in the labour market. Since the pandemic began, a larger share of women compared to men in formal employment have seen their paid work hours reduced. And in most countries, it is women overall who are noting the largest drops in income from their paid jobs, regardless of whether they engage in formal or informal employment. Even before the crisis, the Asia-Pacific region was the only region in the world to see a regression in women's labour force participation rate. SDG 8 aims to promote sustained, inclusive and sustainable economic growth, full and productive employment and decent work for all. While progress towards inclusive growth and decent work was limited prior to 2020, the pandemic does present an opportunity to reorient business as usual and to advocate for systemic change that can transform how we define economic success and women's economic empowerment. At the core of this transformation is one of the key policy recommendations to address women's unpaid care and domestic work. We know that even before COVID-19, women and girls in the Asia-Pacific region spent between 3 and 11 times more time per day doing unpaid care and domestic work compared to men and boys. This has been exacerbated by the pandemic, which has left many women unemployed, while others struggle to balance the responsibility of working from home with childcare and caring for others. Data from UN Women's Rapid Assessment Survey also shows that in all 8 countries surveyed, women are more likely to have seen increases in both unpaid domestic and unpaid care work since the spread of COVID-19. Research shows us that the burden of unpaid care is a major hindrance to women's entry into paid employment. So I'm delighted that to shine the light on an innovative entrepreneurial approach to addressing women's unpaid care work, we have with us this morning Nadira Yusoff. She is the founder and CEO of KiddoCare, a technology-driven platform that connects parents with reliable, trained and certified babysitters. This includes Malaysia's first mobile babysitting services. During the COVID-19 outbreak, KiddoCare also notably offered subsidized childcare services to frontline healthcare workers. So Nadira, thank you so much for being with us. And I'd like you to please tell us a bit about KiddoCare and the model that you've developed. How is KiddoCare providing more women opportunities for decent work and equal economic participation?
Thank you, Sarah. I'm very happy to be here and sharing about what KiddoCare has been doing and what we plan to do. KiddoCare is primarily a platform that connects parents with on-demand childcare providers, right? To be honest, we don't just serve parents, we also serve our corporate partners such as the hotels, hospitals. We serve kindergarten and childcare centers during the pandemic especially, so they did not have enough workers, so we sent in our stand-in workers as well for them. So the services that we provide includes childcare, includes special care for children who require special needs. We also support learning, as well as we cater to children needing very specific care, like if they are recovering from any illness or require certain types of medical attention. So we're a care platform. but right now they're very dedicated towards children. So we like to see ourselves as a circular economic model. That's what we are promoting. We bring in women, of course, we train them and make sure that they are able to then provide the care services that the market requires. But by doing so a woman comes in to support another woman and empowering her with other types of opportunities. And that's how the circular model actually comes about. And this other mother could then, participate in starting her business or work or even care for herself, which is very important, in our lives. What we provide is the opportunity for women to come in and provide not just childcare, but also learning support, educational support. We also take in women who can also provide food for other families, transportation services. So it's really an ecosystem for women supporting other women, but they are compensated for the work that they do. And one of the things that we really want to look at is making sure that the market could also appreciate the kind of value or the work that they do and compensate them with fair pay. And that's what we are currently doing. We offer flexible working arrangement. They can work anytime they like, and the technology enables them to actually select the kind of jobs that they want, which is suitable to them. So that's the model of KiddoCare.
Thank you so much, Nadira. It's really inspiring to hear that, and I love the way that you talk about increasing the value of women's work, which we know is so often actually undervalued in the market. So
yes,
thank you.
That's a challenge that we have to overcome.
Indeed. And in fact, I'm going to ask you a little bit more about challenges with my next question. So I wanted to ask you, maybe what are some of the challenges that you face in scaling up your model? And what are some of the key lessons that you've learned from running a care enterprise in Malaysia? And maybe also some reflections on how that could be applied to help other women-led enterprises in the region to develop their business models as well. Over to you, Nadira.
Thank you for that question, Sarah. So we would say, we're a fairly new company. We're about 2.5 years old now. And there are challenges in a few areas if we were to scale. Primarily, of course, we require the technology to be more advanced if we were to really deliver on our promise to become an on-demand care platform. Technology also enables us to actually solve certain inefficiencies in current, childcare environment. It provides better safety, monitoring capabilities, and things like that. So that is very required in terms of scaling. But there are other things that we also face challenges, and we're still trying to solve them. I think if anyone were to scale this kind of model anywhere, the primarily challenge would be how do you actually get the market to trust you, to trust the service, because in the region, as it is, we're very dependent on families and things like that traditionally to take care of our children. And we are still very much inclined towards conventional childcare centers. But, of course, we will still require conventional childcare centers, but the way of work for most people have changed. So the requirement may also change, right? So it's just growing with the lifestyle. So trust. And we talk about trust, there's also the parents' trust and also the provider's trust. Now, how am I going to go into somebody's house ensuring my own safety? So that's the other thing. And this is how we're actually using technology to actually, manage those kind of issues. The other challenge that we feel, or rather a point where it's going to be challenging, is going into different countries and facing different kind of policies and regulation. And at the moment, policies and regulation are there for conventional childcare centers or institutional centers. And there isn't any kind of a standardization of this kind of work and on-demand kind of work. And we really should look into that if we were to, allow the market to accept this and grow regionally. There's also the area of getting market, of course, again, appreciating the value of care. And really, looking at willingness to actually provide equal pay or fair pay towards the service providers. We understand that childcare may be expensive in certain areas, especially for on-demand models. So we also look into how government can play a role in terms of providing some tax incentive for parents or even subsidies And on KiddoCare's angle, so what we are doing is also a concept of community childcare as well as shared carer to allow parents, small groups to then distribute the pay, and still the provider receives equal pay. So these are the kind of challenges that we feel we have to overcome in case if we want to, of course, scale. And we would love to see more of this kind of model, everywhere across the region. We know how important this is, and it allows women to come in and even become providers at different times with different types of services. So yeah, that's.
Thank you so much, Nadira, for highlighting those lessons. And I'm sure we'll be coming back to you in the Q&A later to learn a bit more. But thank you so much. I really appreciate it.
Thank you.
So next, we'll be turning to talking about SDG Goal 13, which seeks to promote urgent action to combat climate change and its impacts. And so we'll be inviting Nguyen Ha, who is the Manager of Sustainable Energy from Green Innovation and Development Center, to speak about this goal. I think all of us are well aware that during COVID-19, with the travel bans and limitations on moving around, we've actually seen a reduction in greenhouse gas emissions of around 6%. But we also know that this is only a temporary improvement. Climate change is unfortunately not on pause, and neither are its impacts. Research shows that women are more vulnerable to climate change compared to men because of their inadequate access to essential resources and their more limited adaptive capacity. But at the same time, women hold a wealth of unacknowledged knowledge that is undervalued or underutilized in climate action. And it's very important for countries and communities to simultaneously tackle the compounding risks associated with climate change, natural disasters, and the pandemic, while integrating gender into all of these mitigation measures and strategies. So, Ha, I would like to ask you my first question. So could you tell us, please, what specific challenges do women and communities in Vietnam face during the pandemic, in addition to the existing effects of climate change? Over to you, Ha.
Yeah, thank you so much. So I'm very happy to hear discuss and exchange about some our experiences to work with women in Vietnam. And you know that in 2020, so Vietnam also have to face with a lot of the impact from the COVID-19, and many sectors was impacted and affected. A number of the labor, especially the women labor, loss of work increased in our countries. And you know that though Vietnam also have the best policy and the control the impact of COVID to quickly the return on the normally the life, and how to say that we also have to control the this from the pandemics. So it's our the opportunity to conduct some work related to how we can improve the work for the women and engage women in the action related to climate change in Vietnam. And in Vietnam has returned to the commitment to implement the climate change climate agreement in the Paris Agreement COP21, and we also developed the NDC to commit that we will reduce emission from to reduce the temperature under the 2 degrees Celsius. And in 2022, we also have the updates NDC, and we commit that we will reduce the emission from to the 9% in domestic and up to the 27% if have a support from international commitment. And according to the NDC, we also have the issue and develop some the planning related to energy PDP, we call the Power Development Plan, and integrated planning of the country. That will also bring more the renewable energy percentage in this the plans, and we reduce the first few plan to reduce CO2 emission to conduct and take place the commitment with the Paris Agreement. And besides this, in Vietnam, we also have the more than the household could not connect with the electricity. At this time, we have the over the 140 household could not access with just the system, and that's why you have to bring more the how to say the solar panel to support for these local can access with the electricity to how to say the meet the necessary demand, example for the lighting and for the education of the office area. And if in this area we have a lot of the women, they could not access with the information and data from the social example. They don't have the radio or television to see how to the information related to COVID, something like this. So it is affect a lot to the clonist and the overhead of the woman. And from this, we recognize that we should bring information to them, and we also the thinking the how we can access with women in this area. And fortunately, we have a support from the government, local government, and we are and women union, and we work with the this group, women group, and we building up for the capacity for them, and we support them how to say the connect with the renewable energy solution in the production and the using to increase income from the agricultural activities, and we also support them connect with the supplier to discount the price when they apply the solution. And the second, we also connect with the financial institution to support for them can access with the how to say the small grants to build the entrepreneurs and to how to say the increase the income for the life, for the necessary the life of the woman and the gents household, because we recognize that a woman is how to say very important in their household. They could they are how to say that they can take all the housework, and they can take a lot of the activity in the outside. Yes, they can produce so many things from the handcrafts, and that's why we think that it is a new opportunity when they can access with the electricity from the renewable energy solution. Now it's very how to say the famous in Vietnam and the trending of the global. Yeah.
Thank you very much indeed, Tara, and thank you so much for making those connections between the global issue and the policy framework, and also the real experiences of women in the communities that you're working with. And I'd like to ask you a little bit more about that, actually, because we know that a gender perspective and working for gender equality is really key in building climate resilience. So I was wondering if you could share with us a little bit your experiences in supporting women's entrepreneurship in renewable energy to strengthen climate resilience. How have you implemented that work, and what have been some of the results so far, some of the successes and some of the learning for you? Over.
Yes, so I think that's for us. In order to implement this project, we have to work with closely with the women groups in the local, and we have a partnership with the women union in the province and the districts and the commune. How to say that we develop the network, women network, to exchange wisdom about our ambition and about the activity we will work with them. And I think that's you know that's by the COVID pandemic, so most of the province have a lockdown policy, and we could not the how to say the work face to face with them. That's why we have to use the technology, and we how to say that we guide for them how they can use the application. Example in Vietnam, we use the Zalo and the Viber and the Zoom to meeting and to discuss about how we can cooperate and conduct the activity in the community. And we also build the platform on the Facebook to we call the kết nối cộng đồng xanh to invite all the women group to join to share about the experiences and the success from the activity to take the lesson learned and give us some the idea for how we can conduct in the COVID pandemics. And I think that besides this, we also have to document the good practice and good success for lesson learned from the other group to share widely. And we raise their voice by the organizer some the talk show, online the talk show to share with the policy decision maker. We invite them to become the speaker to talk, share the voice and share the story with the stakeholder. It's our experiences when we work.
Thank you very much indeed, Ha. That's really, really interesting. And I love the part about giving the space for those women to raise their voices and share what they've learned and what they've experienced as well. It's very powerful. Finally, Ha, I have one more question. I'd like to ask you, what action do you think is the most critical in order to scale up the existing experiences and amplify women's voice and leadership in this renewable energy sector?
I think that's I think that from our experiences, that's we think we have to build strong network and connect closely with the women at all the level. And I think we should share share their success to how to say to impact to other group, to scaling up also the how to say the inform the role of the woman into all the activity, and we have to base on the needs to design the activity more how to say the fits with the context.
Thank you very much, Ha, for sharing your reflections. And we look forward to come back to you during the Q&A later in the panel. Thank you so much. So now we're going to move on to the last SDG that's under review in today's discussion. This is Goal 16 on peace, justice and strong institutions. SDG 16 aims to promote peaceful and inclusive societies for sustainable development, to provide access to justice for all, and to build effective, accountable and inclusive institutions at all levels. Since the outbreak of COVID-19 and the accompanying strict lockdown measures that have continued to jeopardize women's safety, data and reports have indicated that the number of gender-based violence cases and the barriers to access to justice have increased. We're really honored to have with us today Ashok Pamidi, who is the CEO of NASSCOM Foundation, which recently launched an app called MyAmbar. This is an app-based solution to help women understand and stand against violence in India. So we're very, very excited to hear more. So Ashok, welcome. And thank you very much for being with us. Hi. So I'd like to ask you, how has COVID-19 impacted women and girls in relation to violence against women? And in your opinion, what are some of the gaps in the provision of legal services and access to justice? Over to you.
Thank you, Sarah, and good morning, everybody. Well, last year, as far as India is concerned, it was reported about 400,000 cases were there as far as domestic violence is concerned. But having said that, we do realize that about 86% of women who experience violence never sought help, and approximately 77% of the victims did not mention the incident to anyone. So as far as the pandemic is concerned, because of the work from home and lockdowns, many of the girls and women, there was no schools, no colleges, so they were compelled to be at home. And so obviously the double burden of work as well as the childcare and parental care fell on women. And this is one of the major challenges because as far as WHO is concerned, they had reported just a few weeks ago that 1 out of 3 women are actually subjected to domestic violence by their intimate partner. So obviously the aspects of domestic violence has obviously increased while enough data has not yet been available. But we have seen that even in very advanced countries like France and US and UK, there's been a reported number of cases have really gone up as far as COVID-19 pandemic was concerned. So as far as justice is concerned, what I would like to share is gap in knowledge or information on the laws to even recognize what wrong is happening with them, or that of a friend or a family member, for example, can complain on a behalf with full protection, right? It's not necessary that the victim itself has to, really go and complain. So that's one aspect. In the pandemic, what happened was they couldn't find a lawyer. It was not easy, but the victims did not find it very easy to find a lawyer. And more than anything, it's the trust factor, because when they are subjected to any form of violence, it's not be, in terms of physical violence, it could be, what I can call it as financial, some sort of abuse, or it could even be emotional abuse. The fact is that you had to have a trustworthy partner or a trustworthy lawyer to go through. So even then, the NGOs were some of these things, or the civic societies were some of the help they could get. But during lockdown, many of them were unable to give access to them, because they did not have a phone, or they were anyway with a 24/7 with a what I can call it as a perpetrator. So that was a bit of a challenge. Then we also had the challenge of under-resourced and overburdened staffs in the case of NGOs and courts during the pandemic. Everything was actually virtual, right? Everything was virtual. Then there was funding and resource constraints were there in terms of giving access to justice. That is the other big challenge. Even then, the financial costs incurred in the legal process, because job losses were there, right? And even now the job losses are there. While men and women lost jobs, the fact is the women lost double that of men. So when there is no jobs, the cost of financial burden also fell on them. So a lot of women survivors might not be able to get the financial help which is required, or take the legal resource what is called for. And lastly, I would say the long and tedious legal process. Actually, many of them, obviously, which I shared the data with you, do not file cases, and lots of district courts were not functional too also at that time. So it took time for the judiciary to adapt to the virtual system. While now it's virtual, but it took a long time. People did not get justice or immediate help that they were expecting from the courts. So that was a little bit of a sordid state of affairs as far as the girls and women were concerned during the COVID times.
Thank you very much indeed, Ashok, for sharing that. And it's indeed, very, very concerning and important to hear about how these different factors created a barrier to women accessing justice, particularly at this time. We know that around the world, actually, there have been quite a few efforts to try to use technology and innovation to increase access to justice and to try to bridge that gap between law enforcement agencies and the public, including remote access to information like helplines, hotlines, risk assessment tools, and so on, and indeed the giving of legal advice. So I know that the MyAmbar app is a very good practice in this regard, and so I'm going to ask you a little bit more about that in my next question. So Ashok, please could you share with us how the MyAmbar app has taken a vital step to leverage technology to help work towards women's safety and empowerment? And it would be great as well if you could share some advice for others who might be considering initiating something similar in their country when they hear about what you've been doing. Over to you.
Yeah, thank you. I think we can, in fact, give you a demo of that. My colleague also is there called Farooq. He might be able to give you a small demo of it. But having said that, MyAmbar, what does MyAmbar stands for? It's in Hindi, stands for under my sky. MyAmbar means the sky. So it's under the sky. It's a beautiful name. And what I would like to say is that technology is actually a leveler, because the fact is that everybody can have access to technology. That is one aspect, and it's virtually at your fingertips, at your hands. So that's one aspect, which is a very, very useful thing, which is there. And the other aspect, which is very important for us to bear in mind, is that technology today can be in your local language. It need not be in English, because in a country like ours and like many other Asia-specific countries, the local language actually rules over or the mother tongue rules over any other language. So the other aspect which we got to bear in mind is this particular technology can have completely an access to anybody in their own mother tongue, so that they are able to get access to any help they want. So that is the other very important element. And the third element, which I thought I would, before I ask my colleague Farooq to give a demo, is we got to ensure that data privacy is assured. We don't want anybody to say if they want to, they can definitely announce their names and put their locations and everything. They don't want to, they need not be. So we are also ensuring that data privacy is concerned, so that, you know, when I mentioned that 1 out of the 3, so even your so-called intimate partner doesn't know that you have an access to a particular technology, and you can seek help and you can get help. And more than anything, education is for all. It is not just for women. Even men need to know, because there could be an unconscious bias which is there, that you have actually created violence for to your intimate partner. It could be, for example, a financial sort of abuse which can happen, or an emotional abuse. So it may be because of unconscious bias which is being there. It's been ingrained into you. Once they're educated, they know that they are doing some mistakes, right? So according to me, an app is a very useful approach for teaching both men and women on domestic violence. With having said that, my colleague Farooq would like to give a short demo of this particular app called MyAmbar. Over to you, Farooq.
Thank you, Ashok. Good morning, everyone. So just continuing from what Ashok was mentioning, while we were designing this MyAmbar app, we had actually two major points in our in our discussion that we wanted to discuss. The first one was related to not just providing a short-term solution by providing those emergency services, but thinking of long-term also, helping women. And when I say long-term, it was around helping women have or rather make informed choices, having that support system at the touch of their fingers, so that they can have the choice of having that access to support services that are available in the country. And this was the major idea with which we were working. We started this work before the pandemic, and when the pandemic started, we kind of felt that this was absolutely something that was required, and we were happy that this was available during the pandemic also for these women. If I would just want to show a quick demo to you, and I want to share my screen and would want to show how the app looks like. So I am, if my screen is visible right now, this what I'm showing on the screen is the web version. But this product, as Ashok has been mentioning, is available in an application form also. Just to talk about a few features that are there, on MyAmbar. First, obviously, is anonymity. We were, very conscious of the fact that women who undergo this kind of an incident, so to say, in their lives, would want to be, would have less, so to say, trust. And that is an important factor. So anonymity for us was also a very important thing. And because of this, the registration is required only with a phone number. There is no need for giving out any details if you want to log into this application to use the services. In fact, there is also a feature of not registering at all and just being able to use some of the services that are provided in the application. So that is there. Anonymity, as Ashok was also saying, is also in the fact that the app is also hidden also, and not really visible if you're a victim of intimate partner violence. And that is also one of the factor that is available, or rather one of the feature that is available there. The second is obviously, as I said, from a perspective of long-term intervention and providing support services. So as Ashok was just mentioning, that during the pandemic, the provision of legal services also kind of took a hit. So we in this application have a ready database of service providers of support services across the country, which are geotagged to your phone location. So wherever you are, if there are support services that are available around your area, those will be geotagged to your location, and those will show in your application. If you want counseling services, if you want mental health services, if you want legal services, those are obviously available around you. The third feature is having a very light interface and easy connectivity. We know that connectivity is a problem in a lot of areas here in the country, and we wanted women to have access to this application. So we have created this application with very simple minimalistic features so that the interface becomes very easy for women to use. Plus, the interface is very light also in terms of its function, so it's very easy to navigate through this interface also. Plus, obviously there is obviously a need of, so to say, emergency services that are always that should always be there in emergency situations. They should always be on your tips. So emergency services like an SOS button, like the feature to share your location with your relatives or your loved ones. Another feature is a whole directory of important phone numbers for women in the country. That is a ready directory of that is also available, whether it is for the women helpline number or the police station, or the central police station, so to say, or the police stations near you also. That is also a feature that has been built. So that is one feature that is already been designed into it. One last and very important feature that I want to talk about is that a lot of women do not might not have the capacity also to understand, because they have undergone such a traumatic experience, that they might not at that point of time would be in a mental space to figure out as to how to identify what next steps to be taken, because they might not be in that space. And that is why we have a very small assessment feature also being built into this application, wherein there is a feature called Am I at Risk? And there is an AI system that has been built, which will actually, with the help of some of the responses that the user will give to the application, will actually let the users know which are the important features of the application for them, and the app will bring out those features right on top of the screen of your phone or your laptop, so that the women are able to have access to the immediate features that are useful to these women. So in all, the idea, when we were working with our partners like UN Women, we would want to thank UN Women. Plus, we have a very important partner called Safety Trust, who has actually helped us accumulate all this information and design this whole application, and given their feedback and their important points while designing this application. So we would definitely want to thank all our partners, and we wish to take this application to as many women as we can in the whole country. Thank you.
Thank you very much indeed, Farooq, for giving us more of a practical demonstration of what the app looks like. And I'm sure that many of our participants might like to download it now to have a closer look as well. And we'll be coming back. So I'd like to thank you both, Ashok and Farooq, for sharing the app with us. And we'll be coming back to you with some questions, I'm sure, because now we're turning to the Q&A part of our panel. So we have quite a few questions that have come in from the participants. And please, participants, if you have more questions, it's not too late to share some more with us. So I would like to actually begin with a couple of questions that have come in for Ha, if that's okay. Ha, are you ready?
Yes.
Yeah. Okay, wonderful. Okay, so Ha, the first question that I wanted to direct to you is quite a practical one that I think reflects the experience that many of us have been having when we try to work with communities during this time. So could you share a little bit about how you were able to implement activities on the ground during COVID-19? Did you have problems, for example, holding gatherings during this time? And how did you then manage to reach your target stakeholders during COVID-19 restrictions? Over to you, Ha.
Yes. So I think that's for the question. How we can manage the activity by the COVID-19. So, and you know, that's most of the province and the location in the Vietnam also have the lockdown policy in the short time. Example, for the other province, when we have the new case on disease on the COVID-19, the province also have a lockdown and policy that we could not travel and we could not miss all the pupil until until they can control the pandemic in the province, and most of the activity we could not conduct directly in the fields. However, we have to build a relationship and the partnership with the local authorities and the local women union. They support us to connect with the women group in the local, and they also the very flexible that they build the network on the some online tool. And we can chat and call the video and virtual the video to exchange about the activity, and we discuss how we can conduct activity until the COVID can control. Besides this, we also have the support from the other network, because before we also other community network, and we connect with them to conduct the activity in the fields. We comply with the policy of the government. We didn't concentrate with a lot of people in the place, but we divide the group in the small group in the X field, and we discuss with them, and we use the online tool to conduct the activity.
Thank you very much indeed, Ha, for sharing that. And I believe, as I said, that's been a common challenge for many. Thank you for sharing how you cope with that.
Yeah.
I have a second question for you, if that's okay, Ha. So I know that your team at GreenID is not only working on renewable energy, and I know you have other initiatives working with women on climate action. So could you tell us about some of the other solutions and on how you bring the voices of communities to policymakers to really help to build green growth? Over to you.
Yes. So I think that's from our experiences. That's we have to choose the build and the establish the groups in the community, and we also the train for them and build up the capacity for them to how they can be the local speaker, and they can take all the action by jazz issue. And the second that's we also connect we engage the media agencies, and we use the social channels to raise voice, and we organize the online forum to raise the voice of the women, and raise the issue and initiative from the women to improve their life. And the third, we also support for them to to make the recommendation paper to send the decision maker to talk about our activity and our life needs the consider from the government. Yes, it's our experiences.
Thank you so much, Ha, for sharing that. I really appreciate it. And it's really, really interesting to hear about some of the ways that you bridge between communities and decision makers and create that space for voice. I'm going to turn to Nadira now, because we've got a couple of questions from our participants for you, Nadira, if that would be okay. So the first question that our audience was asking is, what role can large corporates play in supporting these new models of care entrepreneurship that you shared with us? Over to you, Nadira.
Thank you, Sarah. That's interesting, because that's also something that we're working on with the corporates, of course. So I guess, we've all been there throughout the pandemic, where we're, being sort of getting used to the idea of working from home and flexible working. And this is where I think the corporates and larger corporations can really put this into a proper practice, in which, flexible working should also come with support for the people around their employees who they need care for. So be it their children or any other elderly person in the house. And this can be done by introducing, of course, that flexible working or working from home arrangement, but at certain times providing that kind of support by maybe introducing some kind of subsidy for their employees, or even having some kind of care hours that they can actually collect from their employers. I guess how corporate and large corporation can also look into their corporate childcare program instead of just looking at building a childcare center, could also be a mobile childcare service, or even and on-demand care hours that you can actually get the people providing the service to the office. So these are some of the thoughts that I have in my head. And yeah.
Thank you very much, Nadira. And I think it's really interesting to hear you speaking about the role that corporates could play in really seeing, I think, their employees in a much more holistic way and being much more flexible in some of the solutions that are offered. So I have another question for you, Nadira, if that would be okay.
Of course.
Okay. So now I think this question touches on one of the really tough things that I think all of us are thinking about, in our work for gender equality. But I'd love to hear from you on it, Nadira. So in your opinion, what are some of the ways to shift the wider social norms that really put the responsibility and the tough burden of unpaid care work on women?
Thank you. I really love that question because it resonates so much with what we're doing. And it also, I guess, supports the first question as well. What role can large corporations do? So I look into the unpaid care work, or rather the shift of putting the whole care burden on women into two areas. So we're looking at from a gender angle. We're also looking at a value angle. So I think we have to look at it from these two perspectives. From the gender angle, of course, it has been a cultural norm, especially in our a region in which a lot of care work has been put onto women. It's just cultural that mothers play more of the role to take care not just of their children but also other domestic work. This will come in with education, this will come in with exposure and awareness, but it also, I think, can be accelerated with the introduction of flexible working to both genders, male and female, because then you would have to put in that role. What we have seen in Malaysia due to the pandemic, there were lesser dependency on foreign workers as domestic help in the house because of the travel restriction. This actually has created some kind of environment where both men and women actually have to come in and play the roles together. And this brings me to valuing the care work, right? And one of the ways is actually to bring in the on-demand caregivers, in which then they will be valued. Of course, the mothers can then continue to work or run their business and have somebody else to come in and care at the time when they have to do their work. So I think these are the two ways that we can add value, actually create the value and a dollar value as well. And start bringing in the gender into this. I think if we have shifted the whole, outlook of last time, just having nurses, only female nurses, and now we've opened it up to becoming genderless, right? It will be that time when we look into care work as a genderless occupation anyways.
Thank you so much, Nadira. Well, I think that, it's very inspiring to hear you speak about that. And I think we all look forward to that day. And I hope that, this moment of COVID can be perhaps an opportunity for us to really look again at some of these things, because I think, this time has really, really shone a light on how all of us actually are absolutely dependent on dependent on care work, and how care work is such a really essential part of everyone's lives, and how important care really is. I actually have one more question for you, Nadira, if that would be okay. We just got one more question from our audience. Now, this one is a little bit about how a little bit of a practical one, a very important one around the way that you organize your work. So the question was really looking at what kinds of safeguarding or vetting procedures that you have in place in order to ensure safety of both your clients, but also of your workers in the childcare business. Over to you.
Thank you. So yes, I think that was actually the first thing that we looked into. Of course, KiddoCare started by women primarily, and we all are mothers, and we care so much about this. The first thing that we put in place in terms of vetting is that all our carers will have to go through a very extensive background check, and we work with our Malaysian police to actually run that check. And if we were to expand, or if this model were to go into other countries, I think this is something that partners will have to work on, working with their own maybe national police to run through the whole background check. So we run a background check on their past reports or records, anything to do with childcare or any type of crime. We even do that for the carers. We actually also run background checks on their husbands if they are married, because we don't want them to come from troubled families, because that will then affect their emotional ability to do their work. We have that. But over and beyond that, we use a lot of technology to ensure, or rather to put in some safety mechanisms in terms of monitoring the service, allowing updates at every hour. We also have the panic buttons for both parents and carers in their service, and we partner with local authorities to make sure that the support can come in fast. So yes, that's the first round of vetting with PDRM, Malaysian Police, and there's also the monitoring throughout the whole service. Thank you.
Thank you very much for sharing that, Nadira. And thank you so much for responding to the questions. I guess we might come back to you for another round in a moment. But for now, thank you so much. And I'd like to go to India now again, back to Ashok. Ashok, we have a couple of questions from our participants for you, if that would be okay.
Sure.
Okay, great. So the first one, this is a very interesting question, I think, about the principles and really underlying the kinds of work that you've been doing. So one of the audience wanted to ask, what would be the principles that govern the designing of technology-based solutions by the private sector for survivors of violence? Sure,
I think it's a good question. I think the guiding principles were security is the first aspect, privacy and safety. These were the three primary concerns which we kept in mind. Okay, so the whole aspect was on the technical aspects, and then the domain knowledge, we can call it. This is which you may. So that actually came from our partner ecosystem, which was actually including UN Women as well as Safety Trust. Because deep knowledge is required, and because it's a legal issue, the domestic violence can come under the legal purview. So we had to be very sure that we are, as far as coming out with various information on the app, has to be legally justified, and it has to be proved. So we used both yourself, UN Women, as well as Safety Trust to come out with that. Then the entire aspect is a very interesting aspect, which we also looked at it, is looking at, supposing we are not online, can I look at it offline? So the whole approach was, can I then download this app and can I use it offline? The answer was yes, we could. So that is the other approach. It's not necessary that every time you got to be online for using the app. You can also use it in offline method itself. So these were some of the guiding principles we used, so that the whole approach was that, as Farooq also mentioned, anonymity was very, very important. The ecosystem of partner selection was very important. So working with a large selection of partners, because we have to have all their helpline numbers available with the nearest location, so that any women anywhere in India should get access to it. So that is the overall principles which we work, and information available in their language. Currently, as I speak, it's only in Hindi and English, but we soon plan to get into other Indian languages as we go forward. So these were the guiding principles.
Thank you very much indeed, Ashok. And actually, we have one more question as well for you from our participants. So could you reflect a bit on what are some of the ways to strengthen intersectoral partnerships to build stronger institutions to respond to violence against women, especially in the wake of COVID?
It's a fantastic question, because what is very important is, see, while let's say our foundation is also considered as more of an IT-led foundation because our parent company is basically an association for technology firms. But having said that, what is very important to look at it is when you're looking at women, it's very important to bring in the intersection of various sectors together because we are keeping women as our center stage. Okay. Now, in this particular aspects, when you look at it, we got to understand that you require, since various SDGs are involved. Okay. So we have to understand that you have a women from, let's say, an agricultural area to a woman who could be a white collared worker like our industry is, right? You have both sides. Again, domestic violence, it doesn't look at, your aspects of economic thing, because we are clearly seeing data clearly proves be it rural or urban or be it into various other ethnicity, it doesn't really matter. So in this aspects, I would say, because we require a larger pool of a sector and we require a larger pool of the civic societies and NGOs. So we require the entire collaboration, and we have seen that in the past, especially when it came to childcare, for example, where my Nadira was speaking. It's wherein we brought in various other sectors together to ensure that a common issue of, let's say, childcare, because the policies, as far as the labor department is concerned, is one and the same. Be it from, let's say, an IT industry to a manufacturing, it doesn't really matter as far as childcare is concerned. The same thing holds good as far as domestic violence is concerned. We got to bring the different sectors together because we are keeping women at the center stage, and irrespective of what they are coming from, we require all the ecosystem of partners and their NGOs coming in together so that we are in a position to offer the solutions and ensure that the women are safe. And it's a very important element which we are clearly seeing, right? That the gender parity, the societal gender parity has a direct bearing on the organization gender parity. So we got to ensure that this, and the fact is that we are all talking about work from home. So no more is it that an organization's prerogative and saying that I am ensuring that my women are safe at my workplace. And where is the workplace? Workplace at home today. So it's become all the more important for all the sectors to work together, because there is very thin line dividing between the so-called work place and a home place, because the fact is the work has gone to home. So in this perspective, I think it's extremely important and imperative that all the sectors get together to sort out a common issue, which is basically going to impact our overall labor force participation of women in our country. And as it is very low. It's only at around 23.6%. So I think it's a very important element. We got to bring all of them together and ensure that we are able to sort out this common issue.
Thank you so much, Ashok, for, I think, really laying out the way that the situation's changed, but at the same time, I think just the enduring importance of putting women really at the center, and as you said, the need for an ecosystem of services to respond to the human need of those women. Yes. I really appreciate that. Thank you so much, Ashok. Now, panelists, I have actually one kind of final question, which is a really, really interesting question that is for all of you. So I'm going to, if it's okay, maybe call on Ha, if it would be okay to go first, and then we'll go around the panelists and see what they think about this question. So let me share the question now. COVID-19 revealed a lot of underlying challenges for gender equality. And at the same time, this COVID-19 time became a testing opportunity for immediate actions and solutions at all levels, from households to communities and to policy level. So what do you think could be the next steps to help us to move forward with the momentum that we've created together? So I think this is a fantastic question, because I think all three of you have really exemplified, this momentum and this innovation and this effort to just really respond to the situation that the women that we all really want to support are facing at the moment. So Ha, would you be okay to go first to talk about that?
Yes.
Thank you.
Yeah. So I think that's for this time, so Vietnam also have to fight with against COVID-19. I know that, and now we how to say that just some province in our country have to lock down until now, and for us in the other location, when we are working on with the woman, we also have to cause a lot of difficult. We could not travel to work with them, and also they also could not conduct the activity in the field by themselves because how to say, the Peruvian government didn't give allow for the conduct any activity with the concentrated people in the place. And for those maybe after at least finally of this month, we can conduct some activity in the province, and I think that is our change and our opportunity when we can work with closely with the woman. For this issue, I think that's from us initiative that we still keep the how to say the online tool, work with the how to say the and as more the partnership with the local people to bring up the how to say the to bring up and the exchange the lesson learned, and how to say we so flexible in the discussion by a lot of the how to say the channel example, though we can I think that we can use the how to say the uh, online the forum to connect all the people to organize the topic to exchange other than we can the how to say the organize in the field, because when we travel we also the uh, emits a lot of CO2, and we think that if we can organize in the online the base, so we can set a lot of the clean air in the all the countries. It's in the my mind. However, we also recognize that we could not only the online the activity, because the local people they how to say the limits a lot of the knowledge in the how they can use online tool. So in from those, we also hope that the COVID can go far away, and we can organize in the activity in the fields to work with the local people.
Thank you so much, Ha, for sharing those thoughts. And I think I'd like to maybe turn now to Nadira. So Nadira, I'd love to hear from your perspective as well about what you think could be some of these next steps that we can take as we move forward together with the momentum that's been created during this time. Nadira, over to you.
Thank you. So I think, yes, we are in that great momentum. COVID has accelerated the whole shift into this new norm. And with acceleration, I don't think we have the time to actually, try and learn things on our own. And it's more important than ever that this kind of forums actually bring together what works. And we should really look into, how do we create those kind of playbooks and start getting other regions and other sectors to even adopt them for as fast as we can. I think it's very important to do that at the moment. And when we talk about implementing, best practices and what really works, it's also crucial to create that kind of support ecosystem for implementation. So it is crucial that we bring in impact investors to come in and see, what are the kind of things that's needed in terms of supporting the rollout. Government will have to come in and look into new policies and regulations. So if I may, I know there is a question for me in terms of public policies, but public sector, I think I want to take it in this discussion, if you don't mind. So one of the roles that the government has to look into is the new ways of work, and the appreciation or recognition of gig type of workers, freelancers, but making sure that we can put in the kind of social safety nets that's needed to support gig workers. I think it is also crucial to start shifting the look of gig workers as freelancers, but rather looking at them as entrepreneurs, because that's what they are. So they can build themselves up as that. There will be a better career progression for them. There can be better growth for them if we start looking at them that way, rather than just looking at them as a gig work. So government will have to come in and do that. So yeah, codify, playbook, implementation, support. I think we have the momentum. It's time to just accelerate and drive it. Thank you.
That is a fantastic message. Thank you so much, Nadira. I really appreciate it. And now I'd like to go to Ashok. Ashok, I'd love to hear from you as well about what you think would be some of these next steps that we can take to really maintain this momentum towards change. Over to you.
Yeah, Sarah, I think an inclusive approach is very important element. While the segregated approach works, right? We say women, for example, let's say our foundation, 90 to 95% of our work is around gender equality. But in my thought process, what I would like to say is inclusive approach is, why can't we get men allies? Because right now, I'm leading, I'm a man, right? But there are very few, when I look around, there are very few men who are diversity and inclusion champions. It's largely women dominated. And whenever I go, it's only women all over. Only I'll be the only man there, which we feel very sorry, because we got to have a lot of men and we got to celebrate it, right? And we got to celebrate those men who are actually creating the cause for working for the group, for the fact of women. Then the other aspect is some of the sectors are very advanced. For example, IT is very advanced in India, 36% women, and the 2x they're growing at the executive level. Good practices are already there. So this best practices prevailing from one sector, can't it be, transferred to the other sectors? Some of those practices can certainly be. So looking at the intersectorial best practice sharing, okay, celebration. And the third aspect is amplification. We got to amplify already some good work, whatever is people are doing, that has to get amplified so that, people are immediately able to recognize, oh, those are some great practices. And there are tangible results coming out of it. One is qualitative, other one is quantitative, the measurements of it, right? It's very important for us to look at all these aspects. So I think we need to do more research in these aspects wherein you are able to quantify it and qualify it further so that we are able to amplify it in a much bigger way. And what's more important aspect, at least I have found out, get men. More men makes a difference. Let's celebrate the men who are making it, because some data says that 40% of the men believe that domestic violence is all right. Then there are 60% who don't believe. So let's celebrate those 60% men who are actually working for the cause of women. I think that will amplify the message further and further, and that will bring in much more gender parities according to me.
Thank you so much, Ashok. And I really, really appreciate your reminder, as well as your leadership, actually, in being one of those men. But I really, really appreciate your reminder. I mean, it's really clear that if we talk about gender equality, we certainly can't move forward with the efforts of only one sex. So thank you very much indeed for that. Dear participants and panelists, I think we're coming just to the end now of our time this morning. In closing, I want to just thank our panel, our fantastic panel, Dr. Tanarak, Nadira, Ha, Ashok and Farouk. You all brought so many fascinating experiences, so much enthusiasm and passion in what you're doing, and I think it was very inspiring, and I think it made it very easy for all of us as participants to really make the connection between action and the very, very pressing need that we have, that we're being reminded of through the APFSD, to really focus on the realization of all of the SDGs and of these 4 SDG goals that are under review in particular. So I thank you very, very much for your reflections and for sharing with us today. I think as we move forward, as the last question reminded us, the challenge is to really continue to scale up, to continue this momentum of what's been effective. Because gender responsive solutions to the crisis, to the challenges of the crisis we're in right now, are absolutely vital at this time and are vital to the realization in the long term of the SDGs. So thank you once again, everyone. And I do believe that this conversation can give us a lot of hope, actually, about some of the important initiatives that are out there at this time. And I encourage all of you who would like to know more. I think we probably have some links in the chat, and we can also share more information if there are other things that you would like to know about that our panelists have spoken about this morning. So with that, I thank you all so much for sparing your time to be with us on this Monday morning. And I thank our panelists once again and the colleagues here for their excellent organization. Goodbye, everyone. Thank you for being with us. Over.
In Kigali, she wakes up.